Well, I think if we were to look at the ideal sort of healthcare system in 5 years from now, what I would hope that we would see would be a healthcare system in which there was not only a transfer of care, both the patient and the electronic information, but also a transition process in which in the pediatric world, the young adult and their family learned about their own health care early on and were able then to make a seamless transition to the adult care world. Well, I think when we're looking at the issue of what are the barriers to transfer and transition of care from the patient from the pediatric world to the adult world, there needs to be a lot of communication between both sides because there is a lot of animosity between the both care providers. The pediatric world, which is very family-centered, very sort of into taking general care of the patient, feels that the adult world is often too into the autonomy of the patient, into not including the family, and into sort of behaving like an adult right away. I think we need to sort of actually have those types of specialists come together and talk about what they want from each other. We need to involve more youth in the transition process. It's fine for healthcare practitioners and even for the family to decide what they think is important. But in the end, it's really the youth that needs to take responsibility for their own health care. I think we sometimes do not think that children can take as much responsibility, and therefore we allow the parents, especially in their late teens, to make all their decisions. I think we need to involve the youth more in their decisions. Oftentimes in the pediatric world, we actually only invite the youth into conversation, so they have to sort of earn the privilege of coming into the conversation, and that shouldn't occur. We should always insist that the youth is there and they have the privilege to opt out of a conversation, but they don't have to earn the privilege of opting in to their own health care. With respect to research around adolescent transitions, there are several key questions. One of the main questions surrounds who's really doing the transition and who should be really the person in charge. I think we need to engage the voices of the adolescents that are in the midst of transition, but also there has been very little research that has engaged adolescents and families who have actually gone through the process and what their feelings were. There has to be a lot of research also into how the adolescents deal with transition. And transition doesn't just involve their healthcare transitions because they're doing many other transitions. We're asking adolescents who have chronic disease issues to sort of behave like other normal adolescents have. But at the same time, several of these adolescents are going through issues with their own autonomy, with their own linking to the groups that they're with. They may not feel part of their peer group. And how does that influence how they transition to the adult world?